recognize the member for Fredericton West-Hanwell.
Thank you, Mr. Speaker. Well, it's a pleasure to rise and join with the Minister of Health in congratulating our pharmacists on declaring Pharmacist Awareness Month. In fact, I think the month started on the 1st and it's now the 23rd, so we've been in it for 23 days, Mr. Speaker, and certainly I've had some discussions with pharmacists in that time. As the Minister points out, we increasingly rely on the service of healthcare professionals like pharmacists to deliver healthcare services to New Brunswickers, particularly primary healthcare services. And I've long been an advocate and continue to support the Minister's initiatives in that direction. I would say that the devolution of these powers, enabling healthcare professionals to work to their full scope of practice, is essential. It's the kind of transformative change that our healthcare system needs, and I'll certainly be doing everything I can to encourage the Minister to do more of it. I would say that part of that deal is that if we empower healthcare professionals to work to their full scope of practice, we need to compensate them for that. And Mr. Speaker, the business model that affects pharmacists doesn't include compensation for these services that they're now offering the public. And I would say, I've made a lot of attempts to better understand the system that pharmacists work under. It is not a free market system. It's a highly regulated system where the majority of the fees are set, in fact, by the provincial government, which to me is a command and control system, which I don't like. I think it should be more free market based. But I would certainly encourage the Minister to continue to empower pharmacists. I think there's more that they can do, particularly with regard to flu vaccinations and those sorts of things that the member has mentioned in his statement. And I would certainly encourage the Minister to find ways to compensate those professionals for their services. Thank you, Mr. Speaker.